Hi, I'm Dr. Alex Dimitriou, and I'm the owner at Menlo Park Psychiatry and Sleep Medicine. The following presentation is intended for informational purposes only. We always ask you to refer to your healthcare provider for any important medical decisions or treatment decisions. A lot of times people come up to me and ask, Alex, how much anxiety is normal? What is the normal amount of anxiety, and at what point is your level of anxiety problematic? So I think the easiest way to think of that is to realize that there is such a thing as a performance optimization curve. And basically, this means that there's cases where it's possible for people to have too little anxiety and effectively not care enough about the matter at hand. Then going a little higher, then there's the perfect amount of anxiety where you're responsive, reactive, but at the same time able to turn things off. Going further down the curve, there enters the point of having too much anxiety, and oftentimes this is correlated with decreased performance, chiefly because people sort of tend to get preoccupied with things. You tend to obsess and ruminate to the point where it's hard to actually get the task done. I'll often tell my patients that I see anxiety as a spectrum along a similar type of mindset. And what you'll realize is that, with too little anxiety, you kind of don't care enough for things. We've often said that, there's people out there that can break the law and do all kinds of terrible things and be able to sleep just fine and not even, bat an eye at anything that they had done. Um, in the middle, most people have a normal amount of anxiety, and this allows them to react well to situations, to adjust their behaviors, and raise their level of alertness as needed to respond to those situations. Um, Going further down the spectrum, you run into people that have too much anxiety. A lot of times, with people with too much anxiety, what I often hear is there's a tendency to obsess and ruminate. Rumination is kind of like you get stuck on something and you just can't let it go. A lot of times, people will come to me and feel like they're always like on edge. They might feel irritable during the day. They might feel hurried or rushed constantly. Um, and there's also manifestations in sleep. Usually, people with a lot of anxiety have what I call battlefield sleep, which basically is the sleep you would get in any situation that could be potentially dangerous or any worried situation. And generally, battlefield sleep is trouble falling asleep, trouble staying asleep, and waking up too early in the morning. A lot of times, people with anxiety feel like they need more sleep, but they just can't get it. A lot of people I treat with anxiety will have trouble taking naps in the afternoon, and that could also be problematic. Um, Anxiety also comes in different flavors. Besides, that normal spectrum of worrying too little and too much, there's also people that experience social anxiety. There's people for whom um, any type of public performance, any type of lunch at work, any type of social gathering, oftentimes creates a high level of worry, self-doubt at times. And it's not unusual for these people to kind of be eager to have a drink of alcohol or something to take the edge off and let them function in these environments. Um, a lot of the anxious people I also treat will have very intense affect. And what that means is my anxious patients tend to feel very intensely. And what this translates into is oftentimes you tend to go very quickly from feeling really good to really bad. Um, Opinions of others sometimes may also follow the same track where people are either amazing or they're terrible. And these opinions tend to be pretty extreme. And the mood shifts that anxious people can experience can often be extreme and many times often mistaken for bipolar disorder because people will say, hey, you were this way 1 minute ago and now you're the exact opposite. And a lot of times to the outside observer, this does look like you're experiencing some rapid shifts. But most commonly, anxiety and just feeling too intensely in general is at the root of that. The last thing I think that's important to consider is that, we're living in a time when we have so many distractions from cell phones, from work, and messages, emails. The inbox is always getting more full by the minute. Um, Mindfulness has become something that's so elusive and so sought after. Mindfulness is described as the ability to be present in the moment, the ability to actually enjoy what it is that you're doing, the ability to be fully present, connected. Some might even venture as far as to say to be in the flow of the experience. And the unfortunate reality is that anxiety, by definition, is almost the opposite of mindfulness. Anxiety makes it so people are preoccupied either about the past or the future, but certainly not present in the moment. And most often than not, I hear sad stories where, very successful, accomplished people will have trouble relaxing, letting go of work, being present at a family dinner, being present at a family vacation, being able to enjoy their kids without picking up their phone and checking the inbox again. So, in many ways, anxiety does detract from that ability to be present. And I think in this day and age when we're all so busy, there's few things that are more valuable than the ability to actually enjoy the moment. The last thing I wanted to say is that for people with anxiety, the main issue is also seeing the forest through the trees. With high levels of anxiety, people get caught up in lots of things, small things especially. There's been books written about this. Don't sweat the small stuff. By definition, people with anxiety tend to do that. It's hard to filter what's important from what isn't, because people with anxiety by default will assume that everything is important. Everything deserves your full attention. And the sad reality there is that focusing on too many of the small things detracts energy from your ability to focus on actually what matters. Um, I hope this has been informative and helpful. Please take a look around the website. Feel free to reach out to us via the schedule visit option if you'd like to do that. And I'd look forward to working with you and helping you see the forest through the trees. Thank you so much.